call today.
Okay.
Okay, please, can we know you, madam?
My name is Dr. Ekpo.
Are you a medical doctor?
Yes, I'm a medical doctor.
Okay. Have you been involved in any way in the management of HIV/AIDS patients?
Yes, I have. I have a little son who was HIV positive when he was born. For the first 12 months of his life, he tested positive, and he was part of the GAINS project, so it was a very objective exercise. He tested positive several times during his first year of life. When he was 18 months, he went for another test, and he was tested negative. During that test, during the time when he was tested, when he was 18 months, he was actually tested with 2 different kits, and both kits came up negative for him at the GAINS Center. Then when he was 2 years old as well, he also tested negative. Now he's over 2 years and he's still negative, and he will remain negative because he's been taking Jubi since he was about 6 weeks old. He's been taking Jubi formula.
Not Jubi, is it your Jubi formula? It used
to be Jubi formula when my daughter, who is a stickler, used to take it.
Okay, now see, but now repeat to us the story of your daughter.
Yeah, in fact, she is going to repeat what she has just told us now, okay. Using Jobelyn, yes. Not Jubi.
Okay.
Jobelyn, okay. But you start your question again. We'll start from you, Daddy.
My name?
No, we start from you, Daddy.
Okay.
Yeah.
Can we know you, madam?
Okay, my name is Dr. Mrs. Ekpo.
And where are you based?
I'm based in Calabar right now. I've moved all over the place, but I'm in Calabar right now.
Okay, well, what do you have to do in Calabar?
Well, I'm a public health consultant. I'm consulting with the government of Cross River State at the moment.
Okay, now how are you involved in the management of HIV/AIDS? Are you involved in any way? Do you have anything to do with the management of HIV/AIDS patients or people living with HIV/AIDS?
Actually, I have a son. I'm personally involved in managing HIV/AIDS in my house because I have a son. He's 2 years old now, and when he was born as an HIV positive baby. When he was born, he was taken to the hospital and he was admitted into the GAINS project. The GAINS project is the Global HIV/AIDS for Nigeria project, and only HIV positive people are actually taken in as part of the project.
Please, for purpose of putting the record straight,
yes.
This son is an adopted son.
Oh yes.
Because you don't want to give an impression that you are HIV positive. Well, no, it has to be put in a clear terms.
Okay.
You don't know where this film can be displayed, and people will have a wrong impression even without any mentioning it.
Okay. My son was adopted when he was 4 weeks old, and he was adopted from an orphanage in Calabar. When he was born, he was apparently born to an HIV positive mother and was abandoned and picked up to the orphanage. So when he was 4 weeks, we adopted him, and since then he's been our son. He tested positive before he left the orphanage, because usually when you want to adopt a child, they go through all sorts of tests. And before we adopted him, we knew he was HIV positive. And because we already had a previous experience with Jobelyn formula, we knew that the Jobelyn formula would help to take care of him, even if he remained HIV positive for the rest of his life. So we adopted him knowing that we had no problems at all. And all through his first year of life, he tested positive at the GAINS Center. But when he was 18 months old, the test that he had to go through showed that he was actually HIV negative, because he didn't get infected by the HIV virus that was in his blood from his mother. And this was because of the Jubi he was taking. He was taking it religiously every day. And because his immunity was increased, he didn't get infected by the virus. And that's what we believe, and that's what we know to be true. And so, till now, that he's over 2 years old, he's HIV free.
Thank you very much. Before you go, you've been involved with this product, which was formerly called Jubi formula, for a very long time, even before it was changed to Jobelyn. And you had a practical experience of how it could help a sickle cell patient, or somebody having sickle cell problem, disorder.
Yeah.
So can you give us, relive your experience of how you encountered Jubi formula before you became Jobelyn, and then what it has done in the management of your daughter who is a sickle cell disorder patient?
Okay. I have a 9-year-old daughter, Ekpo, who's standing here right now. She was born with sickle cell disease, and when she was born, we did tests to find out if she was a sickler, and found out that she was a sickler when she was 2 years old, because she now started having symptoms when she was 2. And the symptoms included having painful crisis, vaso-occlusive crisis sometimes as well. And we tried to manage it with drugs, making sure that she had enough hydration, taking her Paludrin and other maintenance drugs. But that didn't help much, because she was having a crisis every 6 weeks, like clockwork. Every 6 weeks, you know that she's going to have a crisis. Then we discovered Jubi. A friend of ours who is a doctor and he works with alternative medicine told us about Jubi and asked us to try out Jubi. So we came. At that time it was known as Jubi, now it's known as Jobelyn, and we started giving it to her first as a syrup, but then we increased it to her taking her capsules. And since she started taking it when she was about 2.5, she's been so good. Her crisis, she gets crisis, but she gets like once or twice a year. And she herself she's grown with this Jobelyn so well that she cannot do without it. Even when I don't remember to give her, she takes it by herself religiously. When she has a crisis, she knows she has to take it twice a day, and she takes it twice a day until the crisis ends. And once the crisis ends, once a day is all she needs, and she does so well. She does everything any other person would do. She plays, she sings, she plays the violin right now. She comes top in her class. She's the first in her class. The day she comes second in her class, she's very upset. She doesn't miss her classes. When she has a crisis or she has any pain anywhere in her body, she goes to school, she takes her Jubi, and she's happy. So,
how old is she?
Tell us your experience of using Jobelyn.
Tell us about Jubi.
How did you find it? Has it been helping you?
Yeah.
Okay, when did you start using it? Can you remember? How old were you when you first started using it?
2.
You were about 2 years?
Old. Yes.
Because how many capsules a day do you take now?
2.
2 capsules.
Two capsules daily. Okay, so how are you feeling? You are always feeling strong?
Yeah.
Okay, very good. So I'm also going to give her the HEPA care, which will help her liver problems.
All right.
Yes, and that is really very, very helpful.
Thank you very much.
So thank you very, very much for granting us this interview.
We thank Jobelyn so much for helping us in our life. It has been so useful to everybody now that my husband actually takes Jubi every day.
That's great.
And he's a young man himself, as you can see, but he cannot do without his Jubi too. So the whole family takes Jobelyn now.
That's great.
Now, madam, can I meet you? Your names and your profession.
Okay, my name is Dr. Mrs. Ekpo. I'm a medical doctor stroke public health practitioner. And my daughter is Ekpo, and she's 9 years old.
Okay, she's 9 years old now?
Yes, she is.
And how long has she been taking Jobelyn?
She's been taking Jobelyn now for about 6 years.
7 actually.
For about 7 years.
Okay.
And as you can see, she doesn't have the normal stigmata of a sickle cell disease patient. Usually, sickle cell disease patients have a big stomach, they have yellowish eyes, they have long, thin limbs, and they usually have a big head. She's like any other person. Usually, people don't believe that she's actually a sickler because she doesn't fall ill. Her crisis doesn't last long enough for her to actually have yellowness of the eyes. So you can see her eyes are bright.
Actually, it happened once.
But it didn't stay.
No.
Exactly.
Okay.
Thank you very much.
Okay.
That's it. Thank you.